Hi friends, I am Dr. Pratap. I have done MD in Forensic Medicine. In today's video, we will discuss a pathological condition of associated with alcohol. In last video, we discussed about drunkenness and we will continue with that alcohol poisoning. In today's video, we will discuss about certain pathological conditions resulting from chronic consumption of alcohol. First is delirium tremens. It results from long continued action of alcohol or poison on the brain. It may occur because of temporary excess of consumption of alcohol, sudden withdrawal of alcohol, sometimes shock after receiving an injury such as fracture, also some types of infection. Also, this delirium tremens are seen. Symptoms includes muscular tremors of face, tongue and hands, insomnia, restlessness, loss of memory, psychomotor agitations are seen, confusion, disorientation, uncontrollable fear, and has tendency to commit suicide, homicide or violent assault to cause damage to property. So usually he has some delirium symptoms, that is unconsciousness, disorientation, uncontrolled fear, and also he has tremors of face, tongue and hands. Other symptoms includes diarrhea, dilated pupils, fever, tachycardia, tachypnea and hypertension may be present. There is a disorientation as to time and place. The person is not able to know which time or time place is present. There is a peculiar type of delirium of horrors where the person has hallucination of sight. The person is able to visualize some objects which is not present, or some hearing, some sounds he may hear but it is not present. The person may imagine insects are crawling under the skin or snakes are crawling on the bed. Delirium tremens is considered as unsoundness of mind and not an intoxication condition. Death occurs in about 5 to 15% of cases due to cerebral edema, cardiac failure or shock. Diazepam is usually given to control the agitation because of delirium. Other than that, no symptom. It is usually considered as an unsound mind, not of an intoxication symptom, but it is seen in because of alcohol. Next pathological condition is Wernicke's encephalopathy. This results from neurological degeneration and hemorrhages in the hypothalamus, midbrain and cerebellum regions due to heavy drinking, vitamin D deficiency, which occurs because of alcohol. So usually there is neuronal degeneration and hemorrhages in the hypothalamus. In this, there is ocular symptoms includes gross nystagmus, ophthalmic paralysis, external ocular paralysis, retinal hemorrhages, papilledema, pupillary dilatation, impairment of vision. So usually the person has nystagmus, that is to and fro movement, and paralysis will be present. Paralysis of muscles will the eye muscles will be seen. In CNS, there is disorientation, confusion, recent memory disturbances, pure attention span, distractibility, peripheral neuropathy, stupor. The person may usually go for sleepiness, confusion state will be present. Maybe apathy and ataxia are also early symptoms will be present. It has a high mortality. Wernicke's suspect high mortality rate can cause death in 24 hours. Within 24 hours, in the untreated, about 80% cases progress to more chronic condition, which present as organic amnestic syndrome called as Korsakoff psychosis, in which there is impairment of anterograde and anterograde memory loss, where the person is so disoriented that he is unable to learn any new information. So, Wernicke's encephalopathy can lead to Korsakoff psychosis, where the person is not able to remember any past events or not able to remember any future events. So because of that, he is unable to learn any new information, anything new. So just he is living in the present. That's one of the condition may be occur. Next condition is the pathological alcoholic polyneuritis and Korsakoff psychosis. The symptoms of polyneuritis are weakness, pain in the extremities, wrist and foot drop, unsteady gait, loss of deep reflexes, tenderness of muscles of arms and legs. Mainly neurological symptoms are seen. Treatment includes diazepam 40 to 80 mg per day in divided doses, chlordiazepam 80 to 120 mg per day in divided doses, or haloperidol 20 mg per day is given. In some withdrawal symptoms cases, only restoration of alcohol drinks helps. So usually in Wernicke's encephalopathy, Korsakoff psychosis, both the treatment has similar diazepam and chlordiazepam is given, and both are sometimes are withdrawal, which is seen in withdrawal. So giving alcohol is the only way the person's symptoms will be relieved. Then condition is alcoholic paranoia. In this, there are fixed delusions, but there is no hallucination. So person has delusions. Delusions are nothing but false beliefs. So the person has some false beliefs which falsity even proved, then he believes even if the falsity is proved. So he has some belief in something which is persists, that is delusion. The person becomes deeply suspicious of motives and actions of those he meets and of his family members. So, in delusion of paranoia, the person believes that someone is trying to kill him. So, in here the person assumes the person anyone he is trying to kill, and usually in the close family members, he assumes the family members are trying to kill him. Next is acute alcohol hallucinosis. Here there is persistent hallucinosis developed within 48 hours after cessation of alcohol intake. Usually it's in withdrawal. Hallucinations may be auditory or visually, and their content is usually unpleasant and disturbing. So person sees some objects or hears something, but it is not usually not there. So auditory visual hallucinations is where the person there is a false perception of senses. So hallucination is a false perception of any senses. It may usually the auditory or visual senses are impaired. The disorder may last several weeks or months. Then alcoholic epilepsy. Here the seizure occurs after a day or more after termination of drinking session. Sometimes the attacks may occur while the patient is actually drinking. So usually it may occur when the person has epileptic episodes may be present. Then cardiac dysarrhythmias. The episodes of atrial fibrillation may occur after 10 to 12 years of heavy alcohol abuse, especially induced by drinking binges, which is also known as ready heart syndrome. In alcohol withdrawal, tachyarrhythmias are commonly probably because of high adrenergic nervous system activity, which may cause sudden death. So the person's withdrawal of alcohol can cause dysarrhythmias and tachyarrhythmias, and suddenly if it is stopped, it may lead also to sudden death. Other condition includes Machiav syndrome. Here there is degeneration of corpus callosum in alcoholic. Then Malarious syndrome, where there is ruptured esophagus with mediastinitis. Then malnutrition is also one of the conditions. Then there may be gastric or peptic ulcers, cirrhosis of liver may be present, myocarditis seen, pancreatitis seen, mental illness may also be seen, where the person is depressed or have a high risk of suicide. Alcohol creates a disturbance in tryptophan conversion also. So one of the condition it also leads. Come to medical legal aspects of alcoholic poisoning. So if the person is drunk, what are the some legal important legal activity legally, what are the conditions should be kept in mind. Come to hazards of alcohol. Fatal alcohol poisoning by alcohol is very rare. Mainly there is mild to moderate degrees of intoxication are frequent and create a social or medical problems. So usually there is associated with social and domestic violence are commonly seen. It is associated with domestic violence and child abuse and suicide, and rarely intoxication is commonly not seen. Alcohol has some personal risk factors. So because of consumption of alcohol, there is chances that it causes some risk to the person. He may die of exposure of some chemicals. So because of some person may added some poison in alcohol and may die because of exposure. Alcohol in the Tecubacter tree can cause pneumonia. He may inhale the vomit or dentures. Because of alcohol, the gag reflex is reduced and person may inhale the vomit. A bolus of food or meat may be inhaled into larynx, can cause death due to choking. Alcohol reduces man's resistance to effects of hypoxia. Because of that, mountaineering person climbing mountain climbers, aviations, they have whenever they climb there is decrease in oxygen, may experience immediate hypoxia if they also consume alcohol. Person who has consumed alcohol may fall and sustain heavy head injury. He may fall into water and may be drowned. He may turn on the gas and forget to light the burners and may die because of burning. He may electrocute himself when tumbling with a plug, or defective electric circuit may also occur. He may take a poison by mistaking it for alcohol. The intoxicated person may driving motor vehicle is a grave danger to himself as well as others. The so-called night there is a Saturday night paralysis occurs when the person sits on the chair at the stage of coma, results when the pressure on the nerve trunk when the arm hangs over the chair, which pressures the radial nerve, which leads to the Saturday night palsy. Then alcohol blackout. The behavior resembles that of blackouts in anorexemia. Here the results from loss of memory of period during which drinking spell, or in some cases the inability to recall what happened over the period of days. So it's condition because of excessive consumption of alcohol, the person is not able to remember what has happened during that period. Amnesia can be fragmentary or total loss of memory. During such state, the person may perform some criminal act and may not remember this after he recovers from the effect of intoxication. So, during this blackout period, the person may commit some acts and he will not be remembered at all, and which may be result in serious consequences. Coming to alcohol and traffic accidents, there is a progressive loss of driving ability as the blood alcohol concentration increases. As we mentioned, the alcohol decreases the coordination. So, it, it is very person who has consumed alcohol is not able to drive properly. The safe driving is interfered due to increased reaction time. The person is not able to react properly if sudden traffic arises. It creates false confidence. A person may drive in a speed because it creates overconfidence. It impairs concentration, dulls judgment, and degrades the muscle coordination, and it decreases the visual auditory acuity. For this all purposes, the person dying abilities reduces and leads to accidents. Usually below 59%, the concentration of alcohol, majority of drivers are not affected. After 50, the effect starts to come. At 60 mg%, the driver of the vehicle is twice as likely to be involved in accident as compared to sober driver. At 100 mg%, risk is 12 times that of normal, and at level about more than 150 mg%, this becomes 20 times more likely. At 100 mg%, all individuals are affected and accidents are commonly seen after 100 mg%. Coming to alcohol and traffic accidents, a punishment for first offence is up to 10,000 rupees or 6 months imprisonment. So, if the person has committed some accidents because of consumption of alcohol, he will be fined up to 10,000, and for subsequent offence it is 15,000 or imprisonment up to 3 years fine. The statute limit of alcohol consumption is 30 mg%. So, if the person has consumed alcohol and if his level is less than 30 mg%, he is allowed to drive. It is more than 30 mg%, he will be arrested for offence and 10,000 fine is applied. Coming to alcohol and criminal behavior, the frequency of crimes committed by a person under the influence of alcohol is not due to failure of realize the nature and consequence of acts, but due to repression of those inhibiting influence that sober person prevent the commission of acts. So usually a person A has grudge against B, and he usually doesn't act, he is controlled, but once the person has consumed the alcohol, that restriction is lifted and the person becomes free to act on that. So usually crimes committed is not because of alcohol itself, because the person already have some influence present, and because of inhibitory effect of alcohol, the person acts upon that and commits the crime. Illegal acts are usually committed while the excitement due to stimulation of the brain at about its sides. So usually at the first stage, when there is a state of excitement is present, only at that time the person commits a crime. There is a strong relationship exists between the abuse of alcohol and occurrence of accidents and acts of violence. As the suppressed feelings of aggression and hostility are released, the drinker goes in a state of artificial display of bravery and commits the crime. Acute alcohol intoxication is a factor in suicides and homicides also. Alcohol slows the reactions of the victims and he may sometimes able to protect himself in time for assault. Once if the victim himself is alcoholic, then also the chances that there is risk for himself, the reaction time of himself is reduced and person may not be protect himself. Alcohol causes dilatation and congestion of blood vessels, so that the injuries results greater and prolonged bleeding. So it causes increases the bleeding time. The person, even the minor injuries will take longer, it will hemorrhage. If the victim is severely intoxicated, he may die from inhalation of blood or vomit while lying on his back following injuries, especially of the head or face. So if the victim is the alcoholic, so there are where he may not be able to defend properly. He may there is chances that any injury will cause to severe hemorrhage, and the person may be intoxicated, may lead to inhalation of blood or vomit, or he may die because of head facing the opposite prone position. He may not breathe properly. Section 355 BNS of Bharatiya Nyaya Samhita tells that if a person is misconducts in public by a drunk person, which is punishable up to imprisonment up to 24 hours, fine up to 1,000 rupees, and also community services present. So if the funny person has misbehaves in the community in drunk, he is punishable up to imprisonment. Alcohol and sudden deaths. So some because of consumption of alcohol, many cases are there where the person dies suddenly. In some persons, alcohol has an effect on myocardium, predisposing to and producing arrhythmias. An intoxicated person during the struggle suddenly becomes unresponsive, develops cardiopulmonary arrest, and dies. There is no underlying cause for death is found in autopsy. So there, even though there is no changes, just there may be a person may suddenly develop some symptoms. He may develop cardiopulmonary arrest and dies. He may also die after violent struggle. The victim is restrained is person if the violent struggle alcoholic person. He may be restrained in such a way that breathing is impaired and producing relative hypoxia. Since alcohol causes an hypoxic condition and decrease in oxygen, and once the person is restrained and he is unable to breathe, then it will elevate the hypoxic condition. Person may die. In some persons, death may result when there is a combined with alcohol and release of catecholamines. The cause of death in such cases is certified as cardiopulmonary arrest, contributed alcohol during violent struggle. So, violent struggle person is alcoholic, which causes usually releases increased catecholamines, which can cause sudden death. Is seen in some cases of alcoholic deaths. Intoxicated person who is severe beaten about by the face may collapse and die. In this case, autopsy is essentially negative. Death may probably occur from combination of serious depression due to alcohol and diffuse external injury from beating. So, if the intoxicated person is beaten, there is chances that even though the injury may not be severe, even then the person may be died because of serious depression. Alcohol after death. So, after death, alcohol examination is usually done. So, alcohol diffuses through the intact stomach wall after death into surrounding blood tissue, including the pericardium fluid and pleural fluid. So, because of that, the free flowing fluid is not useful for estimation of blood. As such, higher blood levels are found at what actually existed during life if the blood samples are taken from parts into which postmortem diffusion has taken place. So, for that purpose, usually the femoral or iliac veins are taken. No appreciable loss of alcohol from body or blood takes place by evaporation or any other means after death. With advanced putrefaction, the entire content of the vascular system, including alcohol, is destroyed. Analysis of this gives the best results if the person has goes into putrefaction because it may be intact in the CSF. In case of putrefacted body, endogenous production of alcohol is not seen in all decomposed bodies. Ethanol and other alcohols can be produced during putrefaction by fermentation of carbohydrates and proteins of the body. So, the bacteria and yeast which are present, they act on the carbohydrates and release some alcohol may be released. This may occur due to enzymes present in the bacteria and yeast or fungi, the commonest being the E. coli. So, they can release alcohol and can lead to false results. The longer the interval after death, the higher the temperature and more is produced. If alcohol is found in the blood and organs but not in the urine and vitreous humor, the alcohol reaction in the blood is probably because of putrefaction. So, if alcohol is present in the blood but it is not present in the vitreous, then it indicates urine or not in the vitreous, that indicates that in the blood it may have caused because of bacteria. Coming to alcohol withdrawal, the symptoms of alcohol withdrawal appears within 12 to 48 hours after reduction in the alcohol intake. Most common symptoms is tremors or shakes. The essential features are coarse tremors of the hands, tongue, as eyelids in association with at least one of the following like nausea, vomiting, malaise and weakness, hypertension, tachycardia, sweating, anxiety, depressed mood and irritability. Then transient hallucination, hallucinosis, headache or insomnia. So, if the person has started tremors of the hands and tongue with this any one condition like weakness, nausea, vomiting, hypertension, tachycardia, anxiety, depression, hallucinosis, or headache combination, the symptoms are considered as person is going to withdrawal. Withdrawal seizures are typically single or generalized and usually develop 6 to 48 hours after last drink. About one third of these patients will develop delirium tremens unless preventive measures are taken. Treatment includes 20 mg of chlordiazepam peroxide, 100 mg of diazepam, which given 4 times daily. Anti-craving agents such as acromegaset, naltrexone, or fluoxetine are used. Behavior therapy, psychotherapy, or group therapy is useful. Some deterring agents which prevents the person from consuming alcohol like diazepam, alcohol sensitive drugs are given. These are my references. Thank you.